and welcome to the Health Q channel, the health awareness channel where our mission is to motivate you to look at the brighter side of their health. Today guys, I'm here to talk to you about some of the common deformities that is related to foot. Kids are more prone to develop foot-related deformities compared to adults. You would not believe me, there are more than 20 plus kinds of foot deformity that can happen in children. Although I won't be talking about each and every one of them, but I would just like to give you an idea about what kind of foot deformities can happen or else is possible and what does it looks like. So make sure if you are interested in this topic to watch this video till the end. Foot-related deformities can be of two kinds. One that is present since birth, which is also called as congenital deformities, and some are acquired, which means happens following trauma during birth or after birth. Foot deformities is important to understand and is important to correct as soon as possible so that it would not lead to other health implications that's possible in future. So, what are the health implications that can happen following foot deformity? First and the most important thing, a foot deformity can alter the child's ability to walk. Normal walking pattern would be totally different or else slightly different when a foot deformity exists. This leads not only to the appearance of the child but also to the balance ability of the child. Child might fall more frequently, gets injured frequently, and in future this might also lead to other musculoskeletal aches and pains. So, although this all kind of conditions have difficulty in understanding for you as a parent, hence it's very important that you see a doctor as soon as possible. So, without going into the details about what this all deformities look like, let me just list out the names of the deformities that could possibly happen in a child. Valgus deformity. Now, valgus means deviation of the body part away from the body. Similarly, in your foot, if the foot's front side is being deviated towards away from the body or else outside the body is called as valgus deformity. Varus deformity is something where the deviation is towards the center of the body or else towards the midline of the body. In this scenario, the foot would look more inwardly deviated or C-shaped. Adduction deformity is something where the forefoot or else the front foot is towards the midline, again tilted, whereas in abduction deformity, foot is deviated away from the midline. Inverted foot, everted foot, plantar flexion deformity, dorsiflexion deformity, pronated foot, supinated foot, cavus deformity, where the child's internal arch is much high compared to the normal. In planus deformity, which is also called in normal terms as flat foot, there is no arch present or else rarely the arch is absent when the child is weight bearing. Another common kind of deformity that could be present in child is congenital talipo-equinovarus deformity. This is a very complex term and requires sometimes surgical or else medical intervention. So these were some of the names just to list and help you know that what different range of deformity can be present in your child. So what should be done in order to first identify that a foot deformity exists in the child, and secondly, if a foot deformity has been identified, what's the line of treatment? Now, foot deformity identification is very important. Hence, it's super advisable that child goes to physician or a pediatrician on a regular basis, at least till the age of 1 or 1.5 years. Because that's the time when, if the deformity is identified, it is easy to manage, since the muscles are flexible enough and the bones are also malleable. This is the time where conservative management works really well. Once the deformity of the kid or its child is identified, doctor will suggest you what's the best mode of treatment, whether to go for conservative way or a surgical way. Well, the conservative method mostly comprise of long-term strapping or else serial casting. The second possible thing that's required is use of some modified footwears. Modified footwears are designed in a way that corrects the deformity in the child. Third is regular stretching exercises. Many a times, parents, especially mothers, are being taught about the regular stretching regime for the child's foot. This can be done with the help of physiotherapist. Even sometimes podiatrist is helpful in coming up with the management of child foot deformity. And in some serious cases, or else in some situations where the conservative management is not possible or doesn't work, at that time surgical management is used, where the role of pediatric orthopedic surgeons comes into picture. In preventive care of child, it's very important that foot is never underestimated. It requires proper evaluation, thorough examination from a medical professional in order to prevent future implications in kids' life. So, if you who are a parent of a younger child, make sure you observe the child's foot properly. And if you anytime feel that the child's foot doesn't seem to be normal, and even if according to you the child's foot shape is normal, make sure at least once you go to a physician or else a pediatrician for a regular physical checkup and evaluate your child's foot properly to identify early diagnosis of foot deformity and prevent it or else correct it as soon as possible. With that note, I will end this video here. I hope you find this information helpful. If yes, make sure you like this video, share it with your friends and family members, and don't forget to subscribe to our channel HealthQ. See you in another video. Thank you.